Meditech 607 updates. Tracker changes. Patients with a disposition of transfer will change the patient's name to bright blue. This previously used to be a dark blue color. The bed column will highlight orange, notifying you that no provider has signed up for a patient. This previously used to appear as a bright blue highlight around the chief complaint. General changes. When searching for orders, you no longer need to hit the clear or delete button to get rid of your search. Once you pick a selection, the search function will automatically wipe out the search engine. When placing orders that have required elements now appear as red edit buttons. Below the order, you will see what the required question is within the edit button. Notice how reason for exam is asterisked. Clinical impression. When selecting the search field, a new window will open. In here you can type in your search. Searches should begin to populate, in which you can choose the one that best fits your needs. Notice you can filter by age group and gender. Clinical impressions will also automatically filter by gender or age group if defined in the dictionary as so. All new clinical impressions have been loaded in by vendor IMO. Utilizing the vendor's list has allowed us to link up all clinical impressions to SNOMED, ICD-9, and eventually ICD-10 codes. With this larger increase to the clinical impressions dictionary, we will no longer be using free text. Notice beside the clinical impression pneumonia, a clipboard with a clock. When you click on it, you will notice that a drop-down for Remain on Problem List appears. Clinical impressions now flow to the problem list, which is managed by admitting physicians. When reviewing the Remain on Problem List, the clinical impression will default to remain for 14 days. If the clinical impression selected is something that is completed within this ER visit, you may change the Remain on Problem List to be until discharge. For instance, a clinical impression of foreign body and ear could be resolved within an ER visit and does not need to stay on the chart for 14 days. Save screen changes. There is now a split screen preview during save, easy access to code visit from save, date and time of PDoc initiation, and additional carbon copy functionality. The old save screen allowed you to assign providers, save documents in draft or signed statuses, and click the required questions button. The new save screen now presents you with a split preview. You can select the expand preview button to see a full screen of the preview. Once you are done previewing your document, you can select the collapse preview to return back to the split screen preview. The ability to click the Enter Code button allows you to visit the Code Visit screen, in which you can look at the detail of your documentation and decide if it meets the level and complexity that you anticipate it to be billed for. From here you can select the View Details to see what items have been documented against, to see if they determine and fulfill the need of the complexity you desired, and what documents have not been documented against. To return to the Sign screen, simply click Sign. You still have the ability to assign providers, but now have the ability to add additional carbon copies to other providers and outside locations. When selected on the Provider button and clicking on the drop-down field below, you will get a lookup to all providers in the surrounding area. If you do not find the provider you desire, simply exit out of the window. This will prompt you to be able to enter free text. If entering yes, you will get the free text provider field. When selected on outside location and clicking on the drop-down screen below, you will get a lookup to the local pharmacies, nursing homes, surrounding hospitals, and funeral homes. Once again, if the selection you're looking for is not available, you can exit out of the window and you will be prompted to enter a free text. If you enter yes, you can do so. Now you're probably wondering, how do these carbon copies actually get to the other specified locations or providers? These are actually automatically printed out once the document is signed, and then we have workers which will look at your carbon copies and send them to the appropriate fax number. Next, notice the date and time field. This is a manipulatable field that identifies the time and date that the document was initiated. It is also displayed in the split screen preview above as the initialization date. At this point, this concludes our 607 training. Thank you so much for listening.